Um,
Yep, perfectly.
okay, great. So I'm Mike Granato. I'm the president and CEO of the Pulmonary Hypertension Association. And again, thank you for joining me today. I'm really excited to present you some insights from the Pulmonary Hypertension Global Patient Survey, or PHGPS, which was a landmark initiative that brings the patient voice to the forefront of both care, research, and policy as well. So we already know that the experiences of living with PH can vary dramatically across the globe, but until now we haven't had a systematic way to capture this variation. So understanding these lived experiences really was essential to us, to this group, not just to improve care locally, but also to inform global guidelines and future research efforts. This is really where we want the patient voice at the center of what we do. So PHGPS is the first survey of its kind, globally collecting data on how pH affects both adult and pediatric patients' quality of life, their healthcare experiences, and self-management. And our goal is simple. It's really to improve care and outcomes for every patient everywhere. The survey was structured into three 10-minute sections that covered really wide range of topics: diagnostics, treatment access, hospital visits, financial burden, quality of life, genetics, telemedicine. It was really designed to be both comprehensive and very patient-friendly. And this was really a true collaborative effort. So we've had the support from PVRI, and both PHA in the US and PHA Europe led some of the efforts in getting patients involved to complete the survey. And Cambridge, University of Cambridge researchers were also Joanna Pepkazava and Joe Newman were critical in this endeavor. And this was endorsed by Ear and Lung. It really brought together patients, clinicians, researchers, and industry partners in putting this together. The survey was built through consensus across disciplines and included over 100 questions. It was open to all PH groups through three responder streams. We had the adult patients, we had the caregivers, and the parents to pediatric patients. We translated the survey and beta tested it in 24 different languages, and it ran globally for about 2 months. And then the responses were analyzed both quantitatively and qualitatively. So we received actually over 3,700 responses from around the world, giving us a quite strong foundation to identify global patterns and regional gaps in PH care. And here's a really good overview of where the responses came from. We had really good representation all over the Americas, Europe, Oceania, and then some Asia and a little bit in Africa. So the data that we got will power multiple outputs, multiple publications. We have a primary paper that we're working on, a pediatric also paper, and a quality of life study, and some qualitative analysis that is being conducted right now. And these are not just academic papers or contributions, but these are also going to be used for advocacy purposes. So we're very well aware. I wanted to talk first about the 10 calls of action. So one of the things that came out of this paper were about this analysis were 10 different things that we identified, and we're calling them calls of action. So I'm going to go over those 10 things. Those are really the main outcome for us from this study. So the first one is the fact that we are well aware that time to diagnosis must be reduced because early detection is really vital for better outcomes. And the survey showed that in some areas, time to diagnosis has improved, showing that that is possible. Um, but the rare character of the disease means that time to diagnosis is longer than more common conditions, which are excluded earlier in the diagnostic pathway. So the first call to action is really to reduce the time to diagnosis. We know that the earlier the diagnosis, the better the prognosis. Uh, the second one, although the majority of respondents had access to a specialist center, there's still a lot of variation. However, only about a third had genetic testing. We also saw significant variation in the treatment of CTEPH. So this leads us to our second call to action, which is every patient deserves access to centers with full diagnostic and therapeutic capabilities, including genetic and advanced interventions. Only about a fifth of respondents reported having completed a PROM, a patient-reported outcome measures, and from those, only a quarter received feedback from their provider. Therefore, we are advocating for patient-reported outcome measures to be integrated into care to track quality of life and guide support for patients. We also saw that only a third of patients discussed the effects of medication, and they were not seeking advice um, in changing or altering their treatment options. So, our fourth call to action is for patients to be empowered to work with their clinicians, especially when managing side effects. This is about shared decision making. PH associations played an important role in patients' lives. That came out from clearly from the survey. We believe more needs to be done by healthcare providers to connect patients and caregivers to PH associations around the world because those provide education, support, and a sense of community. Um, PH has a huge impact on work and education that came out clearly from the survey. So the sixth call of action is to design systems that support the necessary accommodations and the benefits that patients need to live a normal life as possible. The majority of patients are open to remote care. And for that reason, we are calling for harnessing technology to improve access. The vast majority of patients currently the vast majority of therapies currently available to treat PAH or treat PAH as only group 1. And our eighth call to action um, calls for other groups who remain underrepresented to get more attention, more focus in research and in care pathways, especially groups 2, 3, and 5. The ninth call, patients show interest and high satisfaction with participation in clinical trials. When they're invited, when they participate in those. But we want to stress that patients should be invited to help design trials as well. Co-design by patients fosters better relevance and trust in participation, and the community needs to make a better concerted effort to reach out to more patients for clinical trial participation because we saw that the majority of patients have not been involved in clinical trials. The vast majority have not been involved in clinical trials, and mostly because they're unaware. And finally, nearly half of respondents opted into future surveys. So GPS-2 will launch in 2026 to measure progress and expand reach. And we are going to widen representation geographically, and we're going to ask more about groups 2 and 3. So just to recap, here are the 10 different calls of action, and you'll have access to these slides, I presume, so you can review them. But there's some future work that we're planning. So like I said earlier, we're planning a second survey cycle in late 2026 with the support of PVRI. And we expect to expand representation and deepen the analysis. And also to support this work, PVRI is launching a dedicated task force in the second quarter of this year to specifically focus on PH GPS. And additionally, we are working and looking into how to enable access to the curated data for investigators as well as our industry partners. So that's my presentation. I wanted to thank you for your time and for your commitment to improving the lives of those living with PH. I think that together, the community in general, by amplifying the patient voice, can build something that is more equitable and more effective for treatment and patient well-being. Thank you.
Thank you, Matt. That was really excellent. And yeah, we appreciate you sharing those very, very important results. And that's a really impressive survey. So yeah, I think that's really nice to see how it went there. We had a comment, really great presentation, Matt, and so good to see the importance of including proms. Yeah, as we, we're coming to the closing stretch, the home stretch of this webinar today, and thanks everybody for being part of it. I had a few questions for Matt, and well, hold on, let me let one of the participants ask first, and then I have a question I'm going to ask you. Where can I register as a patient to be taken up in the next survey? Is there anywhere like that?
There's no registration per se, but when the survey is out, um, depending on where you live, Daniela, you will see your local PH association promoting the survey,
Mhm,
mostly through social media or direct emails to patients.
mhm,
So that way you will know about it and you'll be able to take it. Also, the PVRI will be blasting about it on their social media and their website as well. So just by
mhm.
going to the PVRI website, there will be a link to the survey and you can select the language in which you want to take it.
So yeah, sign up to the PVRI newsletter, amongst other reasons to do that maybe. And yeah, stay tuned for 2026 when that next version is out. Matt, I thought the calls to action were really cool, and I was just wondering, have any local PH groups used those in their advocacy yet? Is there a plan to, develop some kind of a campaign or develop further tools so that people can kind of put those calls to action, into action in their country with maybe just adapting things a bit? What are your thoughts on that?
So that's our next step. So now that we've are sort of got the first view of the data, in addition to the papers, we are planning on giving sort of country reports to those countries that participated, and so they can use those calls to action in their own country. Some may be more relevant than others, depending on the results by country. But absolutely, that's sort of the next step.
Nice, thanks. Another question here. What kind of efforts are there to communicate the results, especially around side effects, time to diagnosis, PROMs, etc., to networks of clinicians?
Well, so again, the idea is to send the data back to the PH associations that participated and that help us spread the word.
Mhm.
And then they will work with their local clinician communities on the specific issues that are affecting their own countries, their own communities. And I would also expect something coming out from PVRI that it's more on the clinician side of the education awareness. At all of these congresses that were mentioned earlier, we're also pushing for education and awareness about the results of the survey. I did this same survey at PVRI in Rio. So we are reaching out to the patient, to the clinician community as well.
Yeah, no, that makes perfect sense, Matt, that you've,